I was 9 months pregnant and 33 years old, a healthy pediatrician and longtime patient of doctors Anderson and Brown, who had delivered my other two young children. My husband and I could not wait to have our third child. And one night after dinner, my contractions started coming about 5 minutes apart. So we packed our bag and we went to the hospital. They told me that I was about 4 centimeters dilated. And after observation, Dr. Caldwell and Dr. Anderson, they made a diagnosis for false labor and they sent us home.
9:25 p.m. 33-year-old Gravida 3, Para 2 at 38 weeks and 5/7 weeks.
Your presentation to triage was discussed with Dr. Anderson by the OB triage specialist. Since there was no change in cervical dilation, you were discharged.
That following evening, my water broke and I called Dr. Brown. And after saying, "Hold your horses," he grudgingly told me to go back to the hospital. By the time we arrived, my contractions were coming every minute. And there wasn't even anyone behind the emergency room desk. But finally, my husband was able to find an off-duty orderly who was able to get us a wheelchair and get us to the birthing center. But the secretary there refused to even call a nurse until I had signed papers regarding the hospital's privacy policies.
Registration 10:45 p.m. Triage admission 10:45 p.m.
After 10:30 p.m., a call bell is present on the counter in case the triage nurse is not at the window. The off-duty orderly who wheeled you upstairs to the birthing center may not have known the proper sequence to follow. Documented registration time is 10:45 p.m. and the time placed in the triage room is 10:45 p.m., which indicates swift placement into a triage room. There are some forms that must be signed for each admission.
In triage, Dr. Davis wanted to conduct a Fern test to see if my membranes had ruptured, when even my lay husband could see that amniotic fluid was soaking the bed and the wheelchair. Nurses were shouting for me not to push, but I couldn't help but to bear down with each contraction. By the time they rushed us to the emergency room, the baby was crowning. He was born in the hallway.
10:59 p.m. Boy delivered 8 pounds, 1 ounce. Spontaneous vaginal delivery.
14 minutes after arrival, you were delivered in the labor and delivery room by the OB triage specialist.
I was left there. I was just lying there waiting for Dr. Brown, and when he arrived, I said, "Where were you?" He said, "Oh, well, I can't come until they call me." He yanked my placenta out, and I bit my lip. And then as he started sewing the laceration after birth, I said, I can feel that. And he just said, "Oh, well, that's just the deepest one." And then he kept going. And he disappeared as soon as he was done.
11:25 p.m. Blood pressure 136/76. Heart rate 85. Hemoglobin 14.
Dr. Brown was on call for his practice that night and was physically on the premises. However, since your delivery progressed so quickly, he did not make it from his prior location. He does not recall yanking your placenta.
We were moved to the postpartum floor several hours later, early Sunday morning, and I started to feel weak, nauseous, and dizzy. And the next thing I knew, there was blood everywhere. Clots the size of frying pans were spurting out of my body onto the bed and even spilling onto the floor. I thought I was going to die. And then panicking nurses and residents, they filled the room, and the crash cart was wheeled in, my baby was wheeled out, and my husband was shouting, "Somebody get Dr. Brown." And then all of a sudden, somebody mentioned a procedure, and then they cut my underwear off, and injections were slammed into my butt. My legs were forced open, and someone forced their forearm up my uterus and pulled out the clots 3 times. I screamed and screamed and screamed. The pain was unbearable. felt brutally violated.
Past 2 medium-sized clots. Orders. 1 IV Pitocin.
Once again, we refer you back to your private physician for a detailed discussion about the hemorrhage you outlined.
Everyone left. I was curled in the fetal position, shaking and crying. And my husband stumbled into the hallway afterward, and he ran into other new mothers on the floor who asked him if his wife was okay after everything that they heard. They were the only ones who ever asked if I was all right.
No comment.
Dr. Brown made his rounds that same morning. He said, "You doctors make the worst patients." And then he asked me if I was up for an early discharge. He just stood there in that doorway, making more eye contact with my chart than with me. I never saw him again.
8:40 a.m. Hemoglobin 11. Blood pressure 90/60.
My husband noticed that the bag of Pitocin, the medicine that's used to treat postpartum hemorrhage, was 14 days overdue. A nurse assured us that Pitocin was good for use up until 2 weeks after the expiration date, and then she quickly removed the bag.
1:50 p.m. IV infiltrate right forearm. Catheter discontinued.
Each unit where Pitocin is supplied is checked on a monthly basis. The Pitocin label has 2 dates on it. One date is the compound date, and the other is the expiration date. Now, is it possible you noticed the compound date?
I lay there dazed and in shock, unable to eat or drink. And when they brought the baby in to be nursed, I went through the motions. Patient care assistants, they came in basically once per shift to chart my vitals. The nurses avoided that room. They acted as if nothing had happened. And Dr. Anderson, he rounded that next morning and he said, "You know, I was surprised that you left early that night." I was stunned. When I told him that our discharge from the emergency room was per his order, he said, "Oh, well, I just thought you came in for a sneak induction." And then he signed my early discharge papers and he disappeared, also never to be seen again. On the morning of our discharge, I kept saying repeatedly to the nurses, "My baby is very sleepy and he's not nursing well and he's starting to vomit." He had lost 10% of his weight within the 48 hours since his birth. But they just told me, stop being a worrying pediatrician mother, and his vomit is just spit up, and that he wasn't sleepy, just content. And they gave us our formula samples and they hurried us out the door.
There was no emesis or spitting documented. Status reports were given to Dr. Frank, and nursing notes indicate that Dr. Frank wanted your baby to be supplemented. The nursing notes indicate that you were informed of this and were provided instruction on supplemental nursing.
Within 1 hour of getting home, my baby threw up again and drenched the bassinet. We rushed him to the pediatrician's office, and then we were immediately sent to the emergency room of another hospital. He was jaundiced and lethargic and dehydrated. The ER staff, they struggled to gain IV access to sticking him in his arms and his legs and his scalp. They admitted him that same night, and it was 5 hours after our hospital discharge. He still had the hospital tags on his legs. It was my 34th birthday.
6 p.m. Infant weight 7 pounds 3 ounces. Bilirubin 16.9. Sleepy, floppy, jaundice to umbilicus. Admit.
Once again, your pediatrician can address your concern in this matter as well.
For days, my baby was hospitalized lying in an incubator, receiving intravenous fluids, phototherapy. He wasn't able to come home for good until he was almost a week old. And even then, he had to have phototherapy and home care, until he regained his weight and his strength.
We're sorry that you were so unhappy with your stay. After a thorough investigation of your allegations, we've concluded that the care you received was appropriate. Thank you for taking the time to express your concerns.
In the months after my son's delivery, I was haunted by the nightmare of what happened. Billboards of the hospital, other pregnant women, my own son, triggered flashbacks. And just bouts of heart-wrenching and sweat-drenched panic. For my postpartum appointment, I went to a new obstetrician who uncomfortably listened to my story and then dismissed my symptoms. After about 5 months, I self-referred to a psychologist who started treating me for PTSD, post-traumatic stress disorder. It was only then that I was able to actually start bonding with my son. On the evening of his birthday, I wrote a letter to the hospital and to the physicians who were involved in assisting in my care. I wanted them to understand the impact that this had had on my life, my family. I wanted them to change the way that they conducted business so that, no one else would have to endure what I did. I wanted an apology, answers, and change, not money. In April of 2010, almost 5 years after my son's birth and 2 years worth of serial rejection letters, I published my narrative on the online medical journal Pulse, from the heart of the medical community. My narrative broke the record for the number of views and comments to any article in the journal's history. And it was at that moment that I realized that maybe I wasn't alone. 5 years ago, I endured a brutalizing hospital experience. Yet, in some ways, it was one of the best things that ever happened to me, because I was given the opportunity to learn the truth about the practice of medicine and a chance to become an advocate for patients. My experience gave me the opportunity to raise my voice and to join it with others in order to heal my broken profession and our ailing healthcare system.